answering your top questions about how to get pregnant naturally fast. Hi friends, I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI, so I'm a fertility doctor. And every day I talk to people about how to get pregnant, what to do, and talking them through infertility and their own fertility. And that's why this channel exists, because I say versions of the same thing every day. And if only more people could hear it sooner, maybe it could help you out. So if you are here to learn more about your body, please subscribe and stay around. Today, I am answering some of your top questions about the basics I want you to know if you are trying to get pregnant, what to do, what to avoid, and busting some of those quick myths about intercourse, conception, ovulation. So number one, do you need to have sex every other day? Do you need to have more? Do you need to have less sex? When should you have sex? So it's important to understand that the egg only lives for 24 hours. So you need to have sperm around the egg in that 24-hour period. Sperm, however, live for 5 days, and they don't live in the vagina. The vagina is acidic, and the sperm is coated in that ejaculate, which is alkaline and protects the sperm. But the sperm rapidly swim out of that, and then they hide or hang out in the cervix and in the uterus for up to that 5-day interval. And that's why you'll hear people say that the fertile window is the 5 days ending on the day of ovulation. And so depending on your cycles or how you want to track, this determines the time interval we tell you. So the basis is the calendar method, which is based on the fact that the second half of the cycle, the post-ovulatory time, called the luteal phase, is about 2 weeks long on average. So if you say, oh, my cycles are 30 days long, and you subtract 14 from that, you would get day 16 as your day of ovulation. That would mean that would be the last day of your fertile window. So if you worked backwards, you'd have 16, 15, 14, 13, 12, and that would be the days you would be trying to target having intercourse to optimize conception. The reality is most of the sperm just live around for that 24-hour, 48-hour period as well. So the day before and the day of ovulation, 15 and 16 in this example, are going to be the top two prime example days. Some people use the calendar method. They want to be very low tech, and they just plan intercourse every other day within that week, which for majority of people is going to be from around cycle day 7 to cycle day 18. So in that 10-day interval, if you have intercourse every other day, in the vast majority of people, you're going to capture your fertile window. Now, you don't have to have sex that much, or you don't have to restrict. So if you are everyday sex people, and that is what is in your relationship, please do not have less intercourse to try to get pregnant. Studies do show the more intercourse you have, the higher your odds of getting pregnant, because you have a higher probability of hitting your most fertile day, the day that you ovulate. The problem is if people are not in the relationship where they have intercourse every day and then they start trying to, they might burn out, it might become stressful, and they may not be able to have intercourse that day when it is most important. So that's why understanding your own relationship and patterns are important. It is not better to ejaculate more. It's not better to save up. That's another thing I see people do, is try to go a very long abstinence window with this idea that they're going to save up the sperm. And we actually know that can be detrimental. So looking at people who had an abstinence window of 7 to 10 days or more versus people who ejaculated every day, it's better if you ejaculate more frequently than less when it comes to that interval. And that's because you get a blockage of dead sperm and debris, and that can make it harder. So we like, clearing the tracks, even if it's at minimum, once or twice a week if you're trying to get pregnant. Frequent ejaculators, frequent masturbators, can you not masturbate if you're trying to get pregnant? That's fine, but we would say, once a day. Same thing, we want ejaculation 1 time per day, really at most, whether that's with intercourse or with masturbation. And that's purely because we don't want to be having such a low volume of sperm when you're actually having intercourse if you're frequently masturbating. Another thing that's always asked is about positioning. So is there a certain position that's best? Do you need to sit with your legs up afterward? Do you need to lie still, elevate your hips? If there was, we would all know. So any position with ejaculation will get the job done. You do not need to do anything specific afterward. Sitting with your legs up putting a diaphragm inside to try to trap the sperm there, elevating your pelvis under your hips. Again, most of what you see come out is that protective ejaculate that's alkaline. The sperm's already left. So you can get up right away, go to the bathroom. What is coming out of you, you don't need to be worried that that is going to prevent you from getting pregnant. And in fact, going to the bathroom after you have intercourse can decrease the chance that you are going to get a urinary tract infection, which is something that some women suffer with after having intercourse, especially frequent intercourse. Female orgasm, although always encouraged, is not mandatory for conception. Otherwise, we'd have a big problem. But it can be helpful, and that is because female orgasm is contractions. There is a hypothesis that those contractions physiologically help egg and sperm meet, because remember that fertilization occurs in the fallopian tube. So the sperm have to get up there and the egg has to be captured by the end of the tube and get into that place. So that's always going to be a pro, and in my opinion should always be the goal, but does not have to be a requirement in order for conception. When it comes to sperm, when you think about boxers or briefs, is one of those better? What about heat or saunas or cycling? The reality is anything not in excess is fine. Boxers, briefs, there's no difference. So whatever type of underwear your sperm making partner wants to wear, fantastic. When it comes to cycling, saunas, hot tubs, people ask me every day, oh, we did this one time on vacation, or oh, he likes to ride the Peloton 20 minutes a day. That's not making a difference, and you can feel comfortable with that. We do see prolonged cycling, especially outdoors, when people are cycling, an hour plus a day. There is a lot of heat from the compression as well of the testes between the seat and the body in that circumstance, and that can hinder sperm production. Remember that the scrotum is outside the body for a reason, because the sperm like to be at a cooler temperature. We actually need a colder temperature for them, for the testes to make sperm and testosterone appropriately. So everyday saunas, everyday hot tubbing, also not recommended. A one-off here and there, you're on vacation, you're not going to go and kill all of your sperm. Another common question I get asked all the time is lubricant. I think there's a lot of bad information out there. So number one, there's been a great marketing campaign by the fertility lubricants trying to make you think that they help you get pregnant. And yes, if I did a study and I compared people who could not have sex because they were too dry and people who used lubricant and then could, this group would get pregnant more. But we don't need any additional barriers between the sperm trying to get to the egg. So if you are having intercourse and you don't need lubricant, no lubricant is going to help you get pregnant. If, however, it's painful, uncomfortable, and you want to use lubricant, that's fine. You're going to look for a specific fertility-friendly lubricant. They're going to say it. They're going to be typically water-based or isotonic. They're going to be very neutral, and they're not going to have things like silicone or other type of properties. No spermicide, obviously, but things like KY jelly, Astroglide, those are no-goes. You want more things like pre-seed or conceive, and it will say fertility-friendly on it. If you are trying to get pregnant or you want to get pregnant and you have irregular periods, please don't just try endlessly. What I see is people will just try and they don't even know if they're ovulating, and they may not be ovulating, and you're wasting part of your own time. So if your periods are not regular and predictable, then you should go see an OBGYN or a family doctor or a fertility doctor so we can start the evaluation to see if you might need help, because it shouldn't be really varying more than 1 to 2 days per month. You should know, oh, my period's going to come in about 28 to 30 days. And if it's coming at 42 one month and then 27 the next, that's too variable. That is too much of an irregular ovulation, and it's going to be harder for you to get pregnant, and you deserve an evaluation for that. I love talking about natural fertility. That's what I did all of my fellowship research on. So please feel free to ask questions in the comments. You can always learn more on the As a Woman podcast, or you can follow along on Instagram at Natalie Crawford, MD. Thanks, friends.